Hello, I am Joel McLeod.
I'm Roland Tanner.
And welcome to another episode of the 905er. A common refrain on this podcast has been criticism of the communication strategy surrounding COVID-19 from our public health officials in this province. Infection numbers have skyrocketed, and it appears that we are quickly losing the plot on this pandemic. Confusion about how and what to do around COVID-19 is rampant through the region and the province as a whole. Where that is most prevalent is in the region of Peel. Numbers there are amongst the worst in the province and do not seem to be getting any better. It should not be surprising then to learn that a region where 60% of the population does not consider English to be their native language, we are having issues communicating to households on how to keep themselves and each other safe during this pandemic. This past week, one doctor wrote an opinion piece in the Toronto Star highlighting the lack of coordination with multicultural media in Peel region to communicate vital information regarding COVID-19 to these communities. Dr. Amanpreet Brar is a general surgery resident at the University of Toronto, and she joins us today to give us her perspective and experience in communicating to these communities in the 905 region. Please have a listen. Okay, well, I'd like to start off by thanking Dr. Amanpreet Brar for joining us today on the 905er. Thank you, Dr. Brar, for taking the time of your busy day to come on for our chat today.
No, thank you for having me today and helping amplify messages further regarding importance of the use of multicultural media.
Well, absolutely. It's been something we've been talking about previously on this podcast. It was just the seeming disconnect between a coherent communication strategy and the province at large, especially in the 905 region, to communicate the important strategies that we should all be taking to help mitigate the effects of COVID-19. I'd like to, if we could start off, I'd just like for you to summarize kind of what you've learned in your knowledge amongst the knowledge of the pandemic amongst the various communities in Peel region, and just kind of this seeming disconnect between facts on the ground and what they're being told from public health officials.
Yeah, so I would say, my sort of grassroots work's mostly been among South Asian community members, but I feel speaking to anecdotally to other members of other communities, like marginalized communities, in particular racialized communities, a lot of these, themes are very similar across the board. So I would say, speaking about Peel, what I really learned from my own lived experiences and chatting with my family, and then from my social media campaign called Humans in Brampton, has been really the stark inequities that have exacerbated the pandemic burden in Peel region. Whether we talk about workplace inequities, whether that's healthcare inequities, or looking at language barriers and inequities regarding to that.
Mm-hmm. And I'm wondering if maybe are we starting to see some rumors and misinformation taking root in these communities? Because I know in your opinion piece that you wrote for the Toronto Star, you were talking about how rumors about the efficacy of the vaccine are going around, that there's so many side effects and it causes more harm than it does good, et cetera, which are all false as far as we know. And I'm wondering, do you see this as doing a bit of a setback on efforts for public health to go in and try and vaccinate and educate and properly inform all members of Ontario as to how to best conduct themselves in the middle of this pandemic?
I wouldn't say necessarily it's misinformation. I would say it's lack of information more so, because really my piece it was essentially about how there's lack of information and lack of engagement of multicultural and ethnic media by public health officials as well as government bodies. So I would say my focus was more on that, and I think that's kind of what has emerged as an important theme, because, like I said, that a lot of people do rely on ethnic and multicultural media for information, and if public health officials and physicians aren't going on those platforms to provide that information, then one can imagine how lack of information would cause confusion and disconnect in the community. So I think that's really the big problem, and that was really my focus, is that we really need to engage multicultural media and use these really valuable platforms in a very meaningful way.
Okay. Sorry, we just lost you for a second there on the connection. I would say I guess my fault to that would be would you qualify this as a failure of public health, not necessarily for Peel, but maybe for all of Ontario, just to properly communicate and have a comprehensive communication plan to communicate the importance of masking and social distance and washing your hands and all those things that we're doing, to make sure that all people of Ontario are informed about how to conduct themselves in this pandemic?
Yeah, I would say it's like even broader than Ontario, because when we look at some of the other communities, even in Alberta, like there was focus on Northeast Calgary, for example, in Alberta, and we know even there, like there's a significant proportion of marginalized, racialized, population there, and there was a lot of blaming that happened, particularly in Alberta, around Northeast Calgary community. And I think what we miss from those narratives are that these populations and communities face a lot of inequities, whether that's healthcare, whether that's workplace, and on top of that, they're not getting the messaging. And I think a lot of it is that people are unaware of how much the reach of multicultural media there is. I don't think that has been measured, and people assume that if you speak and know English, you probably watch mainstream media. And I think, we need to also keep in mind that even people, when they know English, understand English, they might not always be listening to mainstream media at home. They might be watching more multicultural media. So it's really important, even beyond pandemic, to use these platforms to provide really critical public health related information, or all like public communication.
I was just going to just more on that point to an extent. That ironically, when we started this podcast to an extent, because we felt there's a real media, a lack of media coverage of the 905 region. But ironically, actually, there is some really strong, powerful, and effective media in the 905 region. It just tends to be to sort of multicultural communities of various sorts, and not perhaps the kind of Western European origin community so much.
Yeah.
And I think maybe some of our listeners would benefit from understanding just how important these avenues are for and not just for recent immigrants, but for people who may have been in Canada for several generations, but are still intimately tied to, for instance, a Punjabi community. So I don't know if you could speak some more about that.
Yeah, I think absolutely. And even beyond like Punjabi community, I know, I was reading just some of the comments that were made to my piece, and it was amazing to read how much it resonated, whether people, were talking about Caribbean media, people were talking about Portuguese media, like all multicultural media in general. Like people are very connected to their roots. And sometimes it's not about just English, and people want to stay in touch with the culture, and they tend to then when they turn on TV at home in evening, they turn on the multicultural shows. So I think it's more than just the language, even though language barrier is an aspect of it, but I think it's also more than that. And I think that's why these platforms are so important, nationally, not just the Peel region.
So do these media outlets have sort of routine communications, say, with public health officials? I mean, CTV or CBC obviously will have their journalists who go to press releases and so on and so forth. Are these outlets able to do that kind of thing, or does the government or health administration, so to speak, reach out to them in an attempt to make sure that those channels are reached?
Yeah, I think there is somewhat effort made, but it's very minimal, I would say, from at least my anecdotal experience. Like I said, I don't have much data to back up this, But anecdotally, from what I've heard and seen, being on some of these channels, is that I think there's not enough engagement. And what's interesting is that, the way I connected with was through a politician, not a politician to speak, but one of the persons who works in politics. And that's kind of how I got in touch with some of these media channels. And so it's interesting that more politicians use these multicultural medias when it, comes to, promoting their messaging, maybe perhaps during an election campaign, but maybe not so much by public health officials. So I think it's really important that, these medias are engaged at all levels and for all public communication.
I find your point there very interesting, Dr. Brar, that because just for a bit of background for myself, I did used to work in politics, and a big part of a communication strategy for all politicians was to, especially in the Peel region, was to utilize the multicultural media outlets to, promote party policy, and you want your face in certain publications, and et cetera. And I find it shocking that attitude didn't translate into communicating, information of a global pandemic, especially now that we're seeing numbers starting to rise exponentially in Peel region. I'm finding it shocking that this isn't an intricate part of a public health communication strategy.
Yes, exactly. I think that's what was interesting to me as well. That almost on weekly, daily basis, right? Politicians would use these platforms, but it's not been the same to same level or even remotely same when it comes to public health messaging. And this is life-saving critical information for these communities.
I was just looking at the article you wrote in the Star earlier this week, I believe it came out. And one of the things I noticed was that, into the void that the official government channels and sort of scientific physicians are failing to fill, we have homeopathy and so-called alternative healthcare providers who are actually quite good at using these channels to reach communities. So is that's obviously something you've noticed. So do you think there's a direct correlation between that and obviously Peel, I believe now really in the whole province is kind of streets ahead of, in the worst possible way, streets ahead of the other regions in terms of spread of COVID. Do you think this is really a direct correlation?
To be honest, without numbers, you can't make direct correlations, in my opinion. So, this could be part of it for sure. But I have noticed that definitely the alternative care providers use these platforms much more. Now, whether that's to do with funding and payments, that is data, again, I don't have. So you can only extrapolate, whether these are actually advertisements that are run on these medias, paid advertisements. It's really unclear to me overall. But absolutely, I've heard from the community members, and even on one of the radio shows, heard those messages myself while I was awaiting my turn to speak to the channel. The messaging from alternative care providers, and apparently they do a really good job of using these media to reach out to the community. But it's not been the same, has not been by physicians and the medicine community and the government bodies when it comes to the pandemic.
And like you said, and like Joel emphasized, it's I know that the parties are highly aware of the effectiveness of these channels when they're talking about party politics and elections. So it's somewhat disgraceful that they kind of, put it in the most charitable way, haven't connected the dots to think, well, this is also something that the government needs to be doing on a routine basis. Now, obviously, we have seen the statistics particularly high in Peel. Other reasons, explanations I've heard connected with that are the fact that the the kind of areas that people in multicultural communities are we working in, so that will be tend to be A, jobs that you can't do from home, and B, some of the lowest paid, and perhaps some of the places which are major warehouses that are seeing quite significant outbreaks. Is that something that you've experienced at all?
Yeah, I've written a few pieces on that, on particularly on workplace inequities, and the social media campaign that my team had started was actually focused on this, was to highlight the workplace inequities that have really exacerbated the pandemic in communities like Peel. We know that for example, like some of the biggest warehouses, food processing, they're all clustered in Peel. And looking at the outbreak data, like a significant proportion of workplace outbreaks in Peel have been in industrial setting. So we know that's a huge risk for transmission and an explanation why these communities are so hard hit. And so it's really unfortunate. And particularly, I'd also mentioned in one of my star pieces regarding temporary employment agencies that are quite prevalent in Peel, I would say. And the temporary employment workers don't have any job contracts, and there's a lot of migration of workers between workplaces, and so you can imagine that's a huge potential for transmission and workplace outbreaks. And I had worked on that piece with Dr. Lawrence Lowe, who's the Peel Public Health Officer, and they're now exploring that as one of the factors for transmission and workplace outbreaks in Peel.
Well, that's fascinating, and probably something that deserves almost is another episode all to itself. But it strikes me, just, and this is me just speaking on a rather superficial level, that wherever we find poor workplace conditions, we have seen some of the worst outbreaks. I mean, I'm thinking of the temporary workers, sort of doing harvesting crops and so on in southern Ontario, who also had significant problems. So it's really been a disease in many ways, which highlights the inequities in our society, and shows us just where we've gone wrong. The things that we haven't been handling correctly, such as long-term care, such as fair and healthy workplaces. It seems to touch on all of these.
Yeah, absolutely. I think the pandemic has really unmasked a lot of issues as well as inequities that have been impacting these vulnerable communities for a long time. And I think the pandemic has just unmasked that.
Now, I mean, something I have a little bit of experience of was just local government and how it reaches out to newer community members. Just in where I live in Burlington, and my experience was that local government really doesn't, unless you go and knock on local government's door, they're not really going to reach out to you. Is that something you would say would be recognizable in say across Peel as well?
I have to say that I've actually been very impressed and also really happy to see the engagement, particularly of the mayor and Dr. Lawrence Lowe. I've started to work very closely with them, actually, in fact, and particularly with Dr. Lawrence Lowe. And in fact, just a few days ago, Dr. Lawrence Lowe and I did a Punjabi radio interview together, and it worked really well, where, he came on that show and provided information, and of course, people see him as the most credible source of information and look up to him. And I was able to translate a lot of that information, and I think that worked really well. And we're hoping to do that in future. So I think at a very local level, there's actually starting to be a lot of engagement. So I'm very happy about that, and I think definitely needs to be more like sort of engagement at a federal and also at a provincial level to address a lot of these issues. But I've been very happy in terms of the local engagement by the mayor and the Peel public health officer.
Dr. Brar, I wanted to ask you, as kind of I think you've kind of fallen into this role as a communicator to the South Asian community a bit. I'm wondering if maybe this be anecdotal, and maybe this might be out of your realm of knowledge, but I'm wondering if you can kind of give a sense of the communities that we're trying to reach with this information. Do they feel like they're being connected or being listened to or heard from, I should say, by the powers that be? Because I bring it up mostly because Roland kind of hinted on this beforehand, that there's criticism of community, of the numbers seem to be rising, but the good deal of members of these communities are in vulnerable working conditions. And I'm just wondering, we constantly hear fix it, but I'm curious, now that we know that there's a bit of a gap in the communication strategy, if we're hearing from the other side in terms of what they need to help look after themselves and their families from them.
Yeah, I think there's definitely disconnect for sure, and specifically regarding workplace and what's essential during the pandemic. And so there's been a lot of mixed messaging to the community for sure, and people have told me that, particularly like what is really essential. Like that's been a question that a lot of people have asked me, because when I tell them like you need to not go out, you need to follow the precautions, they ask me, very reasonably so, their question is, well, I'm manufacturing like luxury clothing, or like I'm manufacturing like a really non-essential item. Why are we being asked to do that, right? And at the same time, we are being told then to follow these precautions, and so they're confused as to it's very like a lot of mixed messaging for them, really. And a lot of it is to do with the workplace. A lot of people do tell me that everything is open essentially in Peel, and particularly in all the manufacturing industry has been open, particularly around now. Like the wave 2, I think wave 1 there were more closures, but this time around everything's been open. Peel's been in a lockdown for weeks and weeks, but all the non-essential manufacturing, packaging, assembling, everything has been ongoing. It has not stopped at all. So there's a lot of disconnect, a lot of miscommunication for sure.
Do you sense that there's a bit of fear, or I would guess categorize it as fear on the part of the South Asian community in Peel, that they are being left by the wayside? That they're being sent into these places to go manufacture, as you said, high-end shirts and wares and whatever have you, and the cost is increased COVID numbers.
Mm-hmm. Yeah, absolutely. And I think it's even beyond South Asian community. Like, I think all like workers, they feel that way, like whether that's delivery drivers, whether that's manufacturing. I think all the workers do feel that way, from what I've at least heard from them, that, they're confused about how much their health is really valued, because they're being asked to do these jobs during a lockdown in a global pandemic, even when some of these jobs don't seem essential to them. But they obviously are afraid, because they need to continue working to put food on their own table. And so it's really hard, and it's a very tough position for them to be in.
Well, I can imagine it'd be tough for them, because they would feel so alone. Like that's the worst thing to do. Is I think it's something we can all appreciate, is that feeling of isolation, especially in a time like this. And to be more so, to feel like you're being taken advantage of for a reason that you're not certain, has got to be frustrating, to say the least.
Mm-hmm. Mm-hmm. Yeah. For sure.
I'm just looking at your Twitter feed right now, and we should mention to listeners that the account is at Brampton COVID on Twitter, and lots of excellent information there. And just mentioning that, if you're basically a casual worker who's depending on a call from an agency every day, and you get sick, you are very reluctant to not go to work, because if you're getting paid $14 an hour, you can't turn down that $14 an hour. It's such it's something that, I mean, as you may or may not tell from my accent. I mean, I'm an immigrant myself. I came to Canada as an adult, and from a country that had just universal sick pay. If you're sick, you get paid and you stay at home. There may be limits to that, but in essence, you never have to think, well, I'm not well, but I need to get paid. And I was astonished to find that here, that's not how it works. It really, I mean, one of the things I hope from COVID is maybe we get to understand these really dreadful practices that we have, where we ask people to make a decision between eating and doing something dangerous like going to work with an infection. Now, that was true in the past with influenza or anything else, but it's triply true now, of course. Have you, do you, during the course of your work, sort of meet these workers who are put into that situation of making those kinds of decisions?
Yeah, absolutely. I mean, I worked as a temporary agency worker myself when I immigrated to Canada, in factories, and I remember I used to be waiting every evening for a phone call about whether I'm going to be called to work next day or not, and it was stressful to like wait till like 7 p.m. To find out if I have work or not next day, and then the next day you have so much performance pressure that if you don't perform well or you don't meet the productivity target, you're not going to be called the next day. And so that was the story like 10 years ago, pre pandemic. And it continues to be the same during a global pandemic. And I can't imagine like the pressure these workers feel, particularly temporary workers, um, because they don't have a paid sick leave. They don't have a job security. They don't even have a job security for one day, forget about a week. Um, so it's really unfortunate, and I think something needs to be done, particularly around worker protection and temporary agencies, because it's really exploitation of workers in many ways.
I definitely, I agree with you on that point there. I wonder if maybe I want to touch upon. I've noticed on my social media feeds the number of doctors and epidemiologists who are frustrated with the lack of data. We're kind of going into, I think we're plus 4,000 new cases today in Ontario. Numbers are going up. The premier went to the microphone today to say the situation isn't getting better; it's getting worse, and we're going to need to start thinking of some drastic actions. Yet we don't really seem to know where these numbers are coming from. We're told it's not in restaurants, it's not in the schools, and that workplaces are like the major factories are okay to stay open under essential guidelines. As a doctor, do you see any patterns in the data, or are you as clueless as the rest of us in terms of where exactly are these infections coming from, and an idea of how to possibly adjust to really start flattening this curve, if that's possible at all now?
I mean, it's really hard to say. I leave in the hands of the expert epidemiologists and public health officials to really pinpoint where the numbers are coming from. I mean, I can only really speak based on most of the qualitative data from our campaign and interviews and stories with workers. That workplaces are definitely a huge source of outbreaks. We know that in Peel, they investigated, I I believe, over 1,500 workplace outbreaks, and 33% of those were in manufacturing and in industrial setting. So we know workplace outbreaks are contributing a significant amount. And where the rest of the numbers are coming, it's sort of unclear at this point to me. But definitely workplace outbreaks are a huge contributor.
Do you think we need to step up our testing and our research game in this province just to get a better handle of where we need to focus our attention?
Yeah, 100%. We definitely need to do more. And we need to understand workplace outbreaks better. So far, we're relying purely on qualitative data, as Dr. Lawrence Lowe just mentioned in his last Peel conference, I believe 2 days ago, that they so far mostly relied on the data from like a social media campaign, Humans in Brampton, to get a better understanding of like temporary agency workers. But I think we need more quantitative data to really understand what's going on. And I think that would also be helpful even in post pandemic, like recovery phase, as well as to address the workplace injuries like post pandemic as well.
It's just I'm going to say this is my last question for this interview. Going forward, what would you say would be the best thing that we can do to step up our communication, to make sure that we're getting all the information out to basically everyone, regardless of your background, to make sure that everyone is educated on how to handle ourselves during this pandemic?
Yeah, I think we need to engage all public platforms and media platforms, and really also focus on multicultural media platforms, radio and TV. We know that a significant proportion of Canadian population relies on these multicultural medias for critical information. So it's really important to engage these medias, and they often tend to also be community ambassadors, a lot of the representatives from these media groups, and they tend to have a lot of influence on the community. So I think really partnering with them and using these really important platforms for public engagement and communication is key. I think it's still not too late because we're still in the middle of a second wave, and we also need to work on an inclusive vaccine strategy and provide adequate and appropriate, accurate information to the communities. So I think it's still not too late to use these community ambassadors in form of multicultural media.
And just as a final question from me, obviously, as a doctor, I mean, I assume you've actually encountered cases of COVID and people suffering from it. And one of the things that's occurred to me, this is a question that's somewhat off topic, but I want to ask it anyway, as you're the first doctor we've had on. If there was anybody listening to this podcast who still has doubts about the dangers of COVID, I feel often we're talking about faceless people, we're talking about people with long-term care, we're talking about communities, and it's so abstract that's part of the reason people can't seem to grasp the dangers involved. Mm-hmm. Is there anything you can speak of from your experience as a doctor that would sort of help emphasize why it's so important that we do everything to flatten the curve seems almost like an obsolete phrase now, but to reduce the mountain?
Yeah, what I can say is that I as a resident physician, I have worked in ICU back in March, April, and I've treated COVID patients. Continue to do so as well now as a surgical resident. And I believe what I have to say is that, sometimes you don't take some things seriously until it really hits you and comes home. But that's not sort of the philosophy when it comes to this disease or the crisis we're experiencing. So it's really important that we follow the public health guidelines and precautions. And when the time comes, take the vaccine to really to take care of ourselves and our loved ones. I've treated patients in ICU, like I said, and also, my friends and people that are known to me have been admitted to ICU with COVID, and it's really scary when that happens. And really hope that everyone follows the guidelines that are by public health and takes appropriate precautions.
Absolutely. Yep.
Well, I'm going to say that's a good note to leave our episode off with. So I'd like to thank Dr. Brar for joining us today. Thank you very much for your insight, and hopefully we start seeing some people in government hear this episode and take note of what you're saying today. Thank you very much.
Thank you very much for having me today.
That's it for this episode of the 905er. Thank you for listening. As always, you can send us your feedback, thoughts, and concerns or ideas for future episodes to our email, info@905er.ca. We'd love to hear from you. You can help us keep the 905er going by financially supporting us through Patreon as well as PayPal. Visit us at 905er.ca and click on the support tab. As well, links are in the show notes for your convenience. Lastly, you can find us on social media. Search for _905er on Facebook, Twitter, Instagram, and LinkedIn. So long for now. See you next time.
You looking to make the most out of this life and optimize your personal wellness? Then check out the Natural Man Podcast. Join me, host Mike C., as we explore all areas of human wellness, physical, mental, and emotional. Learn strategies to optimize your own well-being and be in the driver's seat of your own health. Remember, your doctor works for you. Learn biohacks, neurohacks, ways to improve sleep, and ways to optimize your body and your mind. Check us out on Apple, Spotify, the Fountain app, and at naturalmanpodcast.com.